Good morning, everyone, and welcome to this webinar covering the Take Shape for Life Health Coach opportunity. My name is Jami Krietzman, and I will be your host this morning. Now, some of you may be clients who've had or are having great success with our program, and you're considering becoming a health coach. Some of you might be entrepreneurs who are looking for a great business to be involved with, and some of you might be healthcare professionals looking to add our optimal health programs for your overweight and obese patients. To all of you, I just want to say welcome. And the purpose of this webinar is to share with you the advantages of becoming a health coach with Take Shape for Life. Let me give you just a real brief background about myself and my Take Shape for Life story. I'm a registered nurse and a certified health coach. My specialty in nursing was in critical care and emergency medicine. Now, as a critical care nurse, I spent anywhere from 48 to 72 hours a week working with other nurses and docs, trying to keep people alive. Now, many of them were suffering from what we call obesity-induced diseases. And me, myself, I didn't eat well. I don't think very many nurses do eat well because you're running all the time, but I didn't eat well, and it was because I didn't want to stop and take time to eat. And I wasn't thin by any means, but I was relatively healthy in a non-sick sort of way, and I ended up injuring myself after moving a 650-pound patient, and I damaged 3 discs in my back, and from there I went on this downhill spiral of gaining close to 190 pounds in less than 2 years. And I attribute that to lack of sleep, which was, that was caused by the pain I was feeling, but also I was self-medicating myself with food because I was thinking it was going to make me feel better, but it didn't. In fact, I felt worse. I felt toxic. My reality was I'd become the exact kind of person I'd taken care of in the intensive care unit. My cholesterol level was extremely high. It was 313. I was pre-diabetic, and I was a heart attack waiting to happen. And I was referred to the program by a physician, and he told me to just try it, And I went on the program, and I successfully lost weight and changed my health. In fact, they wanted to put me on diabetic medications and cholesterol medications, and I sat there and I said, can we just please give me 6 weeks? Just give me 6 weeks, and then we can repeat the blood work. Well, I was on the program for 6 weeks, and my cholesterol, I said, was 313. It went down to 170 in 6 weeks without any medication. And then it's called the hemoglobin A1C, which is a measure of blood sugar over a 3-month period, and that went down to normal. So, I didn't need medication. The program had really made a big impact in my life. But the person who made a really big impact was my health coach. She's an awesome person, and it's her and her husband. It's a health coach team. But like my health coach, Terry, she kept saying to me, you would be a great health coach. You need to look into it. And I would say to her several times, no, I'm a nurse. I'm not a health coach. Well, guess what? Part of my new reality was that I couldn't lift patients anymore because my back was still a mess. And so my bedside nursing days were over. And I was afraid. I was still working, but for who knew how much longer, and I wasn't enjoying what I did anymore. I was doing more paperwork and more administrative things, managing, and very little actual hands-on patient care. And that, to a nurse who is a hands-on kind of person, is not fun. So we were a 2-income household, and my health coach approached me again about the opportunity, and this time I told her that I would think about it. And I discussed it with my husband, and we decided to take a leap of faith and embark on the health coach opportunity. Now, being a nurse, I had a desire and passion to assist and care for people, but what came about with me being on the program myself and having those fantastic results was a passion to assist others to optimal health and not via medications and surgery. I saw that making healthy lifestyle changes can have an incredible impact on a person's health. So for me, being a health coach was a perfect fit. In fact, it snowballed on me. I was working full-time at the hospital and health coaching part-time, and I was making quite a bit of money part-time. And within 3 weeks, I had reached the level of executive director in the company. And I'll go into what executive director is a little bit later in this webinar. But honestly, it's been a wild ride for me ever since that time, and I have loved every minute of it. I have never experienced the things that I've experienced since being a health coach. I was able to go places and do things that I never had time to do before. So it has just been, it's just been a wild ride, and it's just been fantastic. Now, this morning, I'm going to give you an overview of our Take Shape for Life program, and the business, the Take Shape for Life business. And I'm going to include a brief background of the company, the market potential of the business, the solution we offer, the role of a health coach, and how coaches are paid and what's required to become a health coach. Now, as I cover these things, I'm going to ask you to ask yourself, does this make sense to me? Can I do it? How do I get started? And in short, is this the right match for me? So let's first talk about who and what Take Shape for Life is and what it's all about. Now, Take Shape for Life is a health network providing solutions for creating optimal health. It's comprised of healthcare professionals. What you're looking at there is doctors, nurses, chiropractors, dietitians, a whole bunch of different healthcare professionals, but also lay people who are certified health coaches. And we have about 10,000 health coaches in the United States right now, and about 20% of those are healthcare professionals. Okay, only 20% of that 10,000. Of the remaining 80%, you're looking at lay people who've been trained to be coaches. And of those, that 80%, 85% of those were first clients, okay? Our mission is to create health versus react to disease, but it's also to get America healthy one person at a time. Now, Take Shape for Life is led by Dr. Wayne Andersen, and we call him Dr. A, and he is just a brilliant man. Now, Dr. A finished first in his class in medical school, and he was the 10th board-certified critical care physician in the United States. And for over 18 years, he ran 2 critical care facilities in Ohio. Now, Dr. A felt like he was practicing medicine too far downstream, and he wanted to help people learn how to create health, since lifestyle and poor eating habits contribute to about 80% of disease. Now, he's the co-founder of Take Shape for Life and the medical director of Medifast. He's the author of 2 best-selling books, Dr. A's Habits of Health and its companion guide, Living a Longer and Healthier Life. The parent company of Take Shape for Life is Medifast. Okay? Medifast is the parent company. Take Shape for Life is the support arm. So when I was looking into Take Shape for Life as just a client, what I liked was Medifast's pedigree and credibility, and I still feel the same. Medifast is the leader in meal replacements for over 30 years. It's a New York Stock Exchange company, and it's number 1 on the top 200 small companies as written by Forbes. So Medifast has their own tools of production. They have an FDA-inspected manufacturing facility and warehousing. Medifast is considered the gold standard in America for nutritional weight and health management, and it's safe, it's effective, and proven with clinical studies at Johns Hopkins and the National Institute of Health, as well as other prestigious universities. Medifast is recommended by well over 20,000 physicians since 1980, and it's now being successfully utilized by over 2 million people. And I do want to emphasize success, being successfully utilized. So let me talk a little bit about what we do as health coaches. Through coaching, we give people the tools to transform their lives. We help them create optimal health through a 4-phase approach, and we assist them with safe and rapid weight loss, followed by instruction in the habits of health. Now, the habits of health that we teach is laid out for us in a way that it is easily understandable, and it makes perfect sense to our clients. We utilize Dr. A's Habits of Health system. It's an excellent tool. It encompasses Dr. A's award-winning book, Dr. A's Habits of Health, the workbook, Living a Longer, Healthier Life, and the video series. Now, what I've really enjoyed about utilizing the Habits of Health system with my clients is when they call me up and tell me about these aha moments they have while they're learning. And to me, that's priceless, because it also totally ingrains the habits of health and those healthy habits and concepts into them, because they're relating to different aspects of what's taught. And that is what we offer our clients. Now, let me tell you what we offer our health coaches. Now, the efficacy of our optimal health programs is widely known. But what we offer health coaches is more than weight loss and physical health. We offer the trilogy of optimal health. So we're looking at healthy body, healthy mind, and healthy finances. Now, when I talk about healthy finances, what I'm talking about is debt elimination, maybe enhancing a lifestyle, financial freedom, a secure retirement, or the possibility to do some charitable giving. When you understand what we do, I believe you are going to see 6 compelling reasons why our business is an entrepreneurial fantasy. We're looking at the right industry, the right program and products, the right partner, the right business model, the right compensation, the right timing. And so I'm going to give you a brief review of each of those. And if you look at what's happening in our country today, it's easy to see why this idea has gotten so much traction. Now, we have a national crisis, okay? So we're looking at the right time. We have a crisis. 70% of adult Americans are overweight, okay? And of that 70% that are overweight, 50% or more are obese. By the year 2030, over 90% will be overweight or obese if we do not do something now. And overweight is becoming the #1 preventable cause of disease. And the human and financial costs are enormous. I mean, honestly, it's threatened our healthcare system. And this challenge has spawned a multi-billion-dollar industry that is growing at approximately 7% every year. Now, this slide is a summary slide that comes from the CDC, which is the Center for Disease Control in Atlanta. And this study is called the MODAC study. And it shows 2 important trends in the United States. On the top, you can see the advancement of obesity from 1994 to 2009. As you see, we have gotten progressively more obese as a nation and progressively unhealthier. Now, on the bottom, you can see a direct correlation of the increase in type 2 diabetes during the time period, that same time period. So there's this direct correlation between overweight and obesity and type 2 diabetes. So we spend 95% of the cost of that disease in its last 5% progression. And yet, it's a disease that can be controlled through proper nutrition and lifestyle. Okay? So, we offer a real solution to this crisis. Our programs are time-tested and proven. With our programs, we help people safely and rapidly lose weight, and then we teach them the habits of health to keep it off for a lifetime, to move to optimal health, and then ultra health and longevity. Success rates are significantly higher, and the key to our effectiveness is our health coaches. Okay, so let me share a little bit about our business model with you. We have a very unique model that really is the new business model for the 21st century. And the person who came up with this business model is Dan Bell, and he is just a brilliant, brilliant man. He very smart. He's been in the business for a long, long time, and he just, all I can say is he's just a brilliant person. And I'm just so glad that, you know, we've been blessed with him as part of our company. Now, we provide professional coaching services, and we are consultative and relational in nature. So what Take Shape for Life offers is a business model that gives people what they really want. No one has a model like this. And the reason that it works so well is that everyone in the equation benefits, and Take Shape for Life delivers on the promises they make. So what you're looking at is a total win-win situation. Now, part of what makes this work so well is that we have a unique and innovative model for compensation. And again, thanks to Dan Bell. We have a diverse group of people who become health coaches from all backgrounds and walks of life. And what I would like to impress upon you is that Take Shape for Life coaches are paid based on their efforts, not on their careers outside of Take Shape for Life or their education. For instance, I'm a nurse, but I'm also a health coach, and I'm paid as a health coach. I have a health coach who I've trained who's a stay-at-home mom. Okay, and she's paid in the same manner as I am, based on her efforts. I have physicians who I've worked with and assisted them in utilizing this in their practices. Guess what? They get paid in the same manner I do. It doesn't matter if you're a physician, a stay-at-home mom, a painting contractor, or a newspaper carrier. We're all paid the same based upon our efforts. Now, some people come on board part-time, some come on full-time, some do this to make a little bit additional income, others do this to replace an income or to enhance retirement or for financial freedom. And as I said before, you're paid based on your efforts, so you earn towards your financial goals. So let's look at what's possible to earn with our business. So first, you should understand that there are no guarantees when it comes to income. This is not a job, it's an opportunity. And if you don't do anything, you won't make any money. It's like wanting to win the lottery. If you don't get off the couch, go to the store, and buy a ticket, the chances of you winning is 0%. And you know what? That is not my own saying. That is my health coach's husband saying, David. He's a funny guy. And so when he said that, that so stuck with me, you know, because I've heard him doing trainings and stuff, and I love that saying, so I wanted to put that in there. So I can't guarantee you an income because you work for yourself. You know, you're not working for me, you're not working for Take Shape for Life. You work for yourself. And people achieve at different rates and earn different amounts based on their efforts. If you were to ask me what is a reasonable expectation for reasonable effort, I would say on a part-time basis, in your first month, you're looking at $350 to $1,000 in your first month as being reasonable. Now, some people have made more, some have made less. However, if you put just 5 clients on the program in your first 30 days as a health coach, you should earn at least $350. And this would equate to the level of what we call a senior coach. Then in 3 to 6 months, if you reach the level of executive director, which we'll go into more detail in a little bit, a reasonable expectation would be $2,000 to $4,000 a month on a very part-time basis. And if you decided to employ our expansion model and work with other coaches, which is optional, you do not have to do that. And if you help 3 of them become executive directors where they're earning $2,000 to $4,000 a month, you would be a national director, and that income would be in the $5,000 to $10,000 per month range. Then in the next 1 to 3 years, if you created, or if you helped, 5 coaches reach executive director, that will put you as a global director, and your income range is $10,000 to $25,000 or more per month. Then if you help 10 people reach executive director, you'd become a presidential director, and you can see the potential income there. Now that I've just explained it in theory, let's take a look at the reality of what health coaches make. Now you saw the potential. Here's the reality. What you're seeing are the actual incomes earned from July through December of 2010. I don't have any newer updates than this. What you will see is that about 50% here of our coaches are very part-time. They earn slightly less than $100 per month on average. That means that on average they're coaching less than 2 people. Okay? Now roughly 50% are senior coaches or higher. In the previous slide, I stated that an income of $350 would be reasonable as a senior coach, but the actual average is it's around $420, okay? And if you go down to the highlighted yellow line over this way, this shows the executive directors and higher, so this yellow line and down, okay? And in the previous slide, I stated that 3 to 6 months to become an ED or an executive director is a reasonable expectation, and that the income would range between $2,000 to $4,000 per month. The reality is the average executive director earns on average about $3,300 a month. Now, I do want to tell you something. I was able to reach this level in 3 weeks. Okay, so I also want you to observe that about 9% of our coaches are executive director or higher, yet about 99% of our coaches do take Shape for Life part-time. Okay? In the previous slide, I said that when you help 3 people reach executive director, you would be national, and that is the income range, and that the income range would be $5,000 to $10,000. Well, the reality is that the average national earns about $9,400 a month. Okay? And I showed you in the previous slide that a global director over here should earn somewhere between $10,000 and $25,000 per month. The reality is that the average global earns over $2,100 a month. Okay? And you can also see what the average presidential earns. These are the actual published figures of the company. Pretty amazing, isn't it? Now, if you are teachable and coachable and willing to put forth the effort, Take Shape for Life offers a blueprint for success. And what that is it's a 2 to 5 year plan to develop a significant income. And I really want you to understand something here. The only way health coaches make any money is if someone is getting healthy, okay? So let's look at what it takes to become a health coach. As a health coach, you are independent, the work is flexible, you earn in proportion to your efforts. It can be part-time or full-time income with the potential for financial independence. You're looking at repeat income potential, low startup costs, no inventory, low operating costs, no prior experience necessary, and you receive complete training and support. And you will enjoy tax advantages as well. So pretty much have a phone, have a computer, you can sit there and take care of people, you know. Now, you also have some unique benefits, you know, with Take Shape for Life as a health coach. You're looking at, there's no territories. I'm in Denver right now, in Colorado. I used to live in Oregon. I still have my clients from Oregon, but I have clients all over the United States. I even have clients out of the country. So there are no territories. You will receive a free co-branded website. The company offers a matching retirement program at leadership ranks. There is great incentive trips. In fact, our newest incentive trip is Puerto Rico. And when I say incentive trips, I'm talking they pay for it, not us. The company pays for the trip. And the trips are, honestly, they're quite easy to qualify for. So, you know, for those of you who are wanting to get on board, I really, really encourage you to get into those incentive trips and to qualify, because you will have a blast. So let's take a look at how it works. In our business, health coaches participate at 3 levels, you know, 3 levels of competency, which are learned one after the other, okay? They are progressive, again, one following the other. You need to do one. You have to learn what's in the first part in order to be able to do the second. So all of us start out as health coaches, and a health coach acquires and supports clients. Now, if a health coach chooses to work with other health coaches, then he or she becomes a business coach and will also then teach new health coaches how to be effective and successful health coaches. And if a coach decides to build teams of health coaches and business coaches, he or she will become a business leader. Now, what I'd like you to understand is that income increases with each competency. Now, as a health coach, you have 2 strategies or 2 options to build your business. You can do one or both. The first is client focused, and then there's client and health coach focused. Now, me myself, in the beginning, I primarily was client focused and not health coach recruiting focused, because I just enjoyed working with people. But the thing is that I ran out of time. And I couldn't help as many people as I wanted to. But the thing that is really cool about our program is sponsoring occurs organically. As people get healthy, many want to become health coaches to pay it forward to others. Now let's look at strategy 1. This is the client-focused strategy. This is our first level of competency, being a great health coach. Now, let's look at the role of a health coach. Health coaches are consultants. They are not salespeople. This is a relationship business, and health coaches get paid for coaching. So the activities of a health coach are to acquire clients, then coach, support, mentor, encourage, and educate them. Clients do not pay you. Clients order from Take Shape for Life. Take Shape for Life pays you to coach them. Okay? Let's look at what you earn as a health coach supporting clients. Now, as a health coach, all of us start out at 20%, and can earn up to approximately 35 cents on a dollar when you are assisting and serving 25 to 30 clients. You should be at around a 35% range. Now, the average first order is approximately $300. So just figure 35% of 300 is roughly $100 a month for an active client that you'd be paid. Now, we have, like I told you, the 20 to 35% is what you will be paid to support your clients. There's also a client acquisition bonus within the first 30 days. And I will go into that a little bit later, but those are nice. And then there's rolling consistency bonuses, which are anywhere from $250 to $1,000 every 3 months. And this is a bonus that the company just gives to you. You're working, but it's their way of saying thank you. Now, here's a hypothetical example showing a health coach with 50 ordering clients with an average order of $300 a month. Okay, now some clients will be long-term users of the product, okay, and they're going to be on the B-Slim. In fact, all the clients, I try to teach the health coaches to make sure to put all clients on the B-Slim club, the savings club, because it saves your client money. And that's one of the things health coaches do, is we save our clients money. So, but with the long-term users, these people are going to use the meal replacements as healthy snacks throughout their lives. And they will use a part of their food budget to use Medifast meal replacements as a part of a strategy to maintain optimal health. But the bottom line is you're looking at 50 active clients equals over $60,000 per year. Okay, and again, this is part-time. This is part-time. So let's bring an example to where Americans are right now. The average annual income in America is somewhere between $35,000 to $40,000 a year. And for that $35,000 to $40,000 a year, you're looking at working 40 or more hours a week. And generally, that comes with about 2 weeks vacation. But you're also looking at costs to earn that income, like auto expense, gas, clothing, child care, eating out. So you're looking at about $40,000, $41,000 for the average American to replace that. If you could work from your home, could you replace it for $41,000? You yourself. Would you be willing to work part-time to earn an extra $41,000 a year? What seems more attractive to you? Spending 40 to 60 hours per week working for someone else, or working 30 to 60 minutes per day working for yourself? Now, I know some of you may be skeptical with the 30 to 60 minutes per day. So let's examine the time it takes to be a coach. To develop that income, it would take roughly developing 30 clients and supporting them weekly. And I'm sure some of you are wondering, what is the time expenditure with a client? The biggest amount of time with a client is upfront, explaining the program, doing a health profile, and helping your client create a menu and order their food. We have lots of tools to help you with this, but it can take you anywhere from 15 minutes to a half an hour with each client. So the next time you spend with a client is the day before they start the program. This may take you 5 minutes to 10 minutes. Then you will call them on each of the first 4 days on the program, and this may take you 2 to 5 minutes, each time. Then you will call them once a week on their weekly anniversary weigh-in, and again, this may take 2 to 5 minutes per call per client. Typical weight loss is 12 to 20 pounds per month. So depending on how much a client needs to lose will determine how long a client is on the program. Since we transition people and teach clients the habits of health to remain healthy, many clients will opt to use the meal replacements as healthy snacks and a part of a long-term program to maintain and to remain at a healthy weight. So 30 to 60 minutes a day. assume you have 30 clients and their meals, they're paying $300 a month for their meals. Your income, because you would be paid at a compensation of 35%, you would be, your monthly income would be about $3,150. And over a year, or 12 months, that's $37,800. Plus, you're going to be getting $4,000 in consistency bonuses. So that's every 3 months the company is going to be giving you $1,000 to say thank you. Okay? Total annual income is $41,800 a year. Okay? You can see on this slide what the income potential is with 30 clients. Now, the limit to strategy 1 is that you're limited based on your efforts, but there's a more efficient way. It's strategy 2, where someone is both client and health coach focused, and this incorporates all 3 competencies of health coach, business coach, and business leader. So let's look at the outcomes of proper coaching. At the end of the day, with proper coaching, we have a healthy, thriving client who has learned the habits of health and is very happy. A satisfied client will either refer others back to you, or he or she will want to join you in the business and pay it forward to people that they know. So it's organic growth. In fact, of the 10,000 or so health coaches that, when I was talking in the beginning of the presentation, probably 75% of that 10,000 health coaches were first clients that got healthy and then decided to become health coaches. So let's discuss the role of a business coach. A business coach mentors, trains, supports, encourages, and leads by example. It's kind of almost the same thing that a health coach does, but you do it, it's pretty reproducible all the way through, but it's just a little bit more advanced. So why should someone want to build a bio network? And I want to let you know, a bio network is when we sit there and we bring on other health coaches. Well, first of all, you're going to utilize leverage then, which will allow you to reach more people and help more people. But it also creates reproductive residual income, and it also creates time freedom and leaves a legacy. So, have you ever looked at the time-money ratio? Some people have time but little money. Some people have money but little time, and some people have neither time nor money, and some people have both time and money. How about you? If you had all of the money and all of the time you needed, how would your life change? If you're too busy now, what's that going to look like in 5 years? So let's look at what limits people. Now the red line, I'm sorry, I'm losing my voice. The red line, this represents most people. And most people here trade their time for money, okay? And they're limited. It kind of caps out at a certain point. These people generally work for other people or for themselves. But to create time and financial freedom, we need to employ leverage, okay? So if we use leverage, there's no limit, okay, to what you can earn. So in Take Shape for Life, we utilize leverage. By yourself, you have only 24 hours a day. So how do you get more hours in your day? Well, our business is similar to the concept of franchising. It's a process of duplication. First, enroll health coaches and help them seek whatever level of success they aspire to achieve. And in the process, look for and develop teams of leaders. And the more money you help your coaches earn, the more freedom you get. So let me walk you through a brief overview of how people are compensated as business coaches and business leaders. If you look at our business from about a 20,000 foot level, there are three major steps. You're looking at first, reaching senior coach, second, reaching executive director, third, developing teams of executive directors. So what does a senior coach look like? A senior coach is someone that has 5 clients or health coaches and a total of $1,000 or more in volume. Now, it can be 5 clients, as I said, or coaches, or a combination that a personally enrolled health coach. And the other thing is that I want you to understand that a personally enrolled health coach is always your client. Okay? So now one of the awesome bonuses available to you in the beginning is if you develop 5 clients in your first 30 days, you'll earn an additional client acquisition bonus of $100. That's really nice. So, I mean, isn't that fantastic? My mentor and health coach told me something a long time ago, and when she told me this, it seemed so ridiculous to believe, but she was absolutely correct. If you eat the food and talk to people, the company, Take Shape for Life, will throw money at you. And I didn't believe her, but let me tell you, I kept getting deposits in my checking account, and I would call her up, I don't understand what I'm getting this for. So, I mean, it is really kind of nice. And honestly, you do. You eat the food, you talk to people, you pattern and show a healthy, Be Slim lifestyle, and you will do just fine. Now, there's 2 ways to reach executive director. There is by volume or by structure. Now, by volume, you're moving from assisting 5 personal clients to about 25 to 30, and that would make you an executive director. Now, by structure, you're developing 5 separate teams of senior coaches or higher. So do you remember, a senior coach is someone who has 5 clients or health coaches, okay, and $1,000 in volume. Now, roughly over 80% of our executive directors become executive director by volume first, and then by structure. Remember I said that I had reached executive director in 3 weeks? Well, it was by volume. Okay, and remember, the average executive director in our company earns over $3,300 a month. Okay, and again, this is part-time. Now, once you become an executive director, then the idea is to identify and help other coaches also reach executive director. Okay, so you're gonna identify the people that want to help more people and who want to grow. All right? Now, earlier I talked about earning $25,000 a month. And this is a hypothetical example of what that could look like. If it would be you as a global director, and remember that's with 5 separate executive director teams and a total of 40 individuals in your organization that have reached the rank of executive director. Now remember that the average executive director earns over $3,300 per month. And also realize that with a structure like this, there are a lot of people getting healthy, okay? Lots. So if you understand our compensation structure, you're going to realize that in this plan, you have the ability to significantly ramp up your income by acquiring and supporting clients. But if you also simultaneously begin to build health coach teams, your income from your team will start out more modestly, okay? So here you see is when you're just working with your clients. Whoops. Sorry about that. You're working with your clients here, and you can go up quite quickly. But as I said before, you kind of top out. But when you're building health coach teams, your income from that starts slowly. It starts out more modestly, but eventually it's going to take and exceed your income from client support. And then if you overlay both curves, our income curve is going to look like this. So it rises really rapidly. This is where you're building clients up, but then you're having health coaches you're working with as well, and then it goes up. Okay? Now, this is the reality of the growth we have experienced over the last several years. We have done extremely well over the last 3 years, and we should more than double this year. And with 10,000 coaches in the country, we have only just begun. And here's where we're going. Okay, as I said earlier, currently there are about 10,000 health coaches in America. And to give you a relative perspective, there are over 1 million physicians, not to mention that over 200, well really 300 million of us are overweight or obese. Okay, and in the next few years there will be 50,000 more, about 50,000 health coaches hopefully, 4 million healthier Americans, and we will be a $1 billion business in the next few years. Now remember earlier I talked about an entrepreneurial fantasy? Well, perfect timing for our program and for our business is what's happening. It's the perfect storm. I want you to sit there and think here now a second. Let's look at the employment situation. Unemployment is way over 9.8%. Real unemployment is like 15%. 14.9 million people are out of work at least. And then there's job dissatisfaction, and Americans are spending more than they're making for the first time in history. Many families have no retirement. The obesity trends, you saw the obesity trends, we're just getting heavier and more unhealthy as a nation, and over 2/3 of Americans are overweight, and over 50% of those people are obese. And since the 1980s, the obesity rate has gone from 15% to 34% in adults. Is that the perfect storm or what? So, is this the right match for you? What are you looking for? What would your life look like if you had the time and the money to do whatever you wished? What are you looking for? Success and fulfillment? Are you looking for the trilogy, And do you have time for yourself? Do you have time for your family to do the things you want to do? How is your financial picture in 2011 looking? Your job security, your upward mobility. If something were to happen to your current career, do you have a backup plan? I want you to understand, being a health coach, this isn't for everyone. But if these questions resonate with you, you should really consider becoming a health coach with us. And, I want you to ask yourself something. Ask yourself, do I have needs that require additional time or money? Do I want what Take Shape for Life has to offer? Do I want to be part of something big? Can I see myself doing this? If the answers are yes, begin the Take Shape for Life Optimal Health Program. Get your career builder's information. Work closely with your business coach to follow the business plan that's set in front of you, and be prepared for success. Okay? Now, I want to thank you all for coming. Please follow up with the person who invited you to this webinar, and if you don't know who invited you, please call or email me and I'll assist you in finding that person. I truly hope that you decide to assist us in getting America, healthy. It is just, honestly, I just love what I do. And there are a lot of my health coaches just love it. Most of the people, I mean, we have a great time. So I want you guys to all have a fantastic day. And again, thanks for coming.